I was privileged to just speak at the Academy of General Dentistry annual meeting in Orlando, Florida. And I've been on that program now for a few years running and a few years straight. And I myself am a big believer, obviously, in continuing education and also in the Academy of General Dentistry. I've gotten to the mastership level, and that's taken some time and energy. Has it been worth it? Absolutely. I cannot tell you in this day and age when patients have lots of dentists to choose from, absolutely. The more continuing education you have, the more you know about what's new in dentistry and what can work in dentistry, the better you'll be able to compete in what is a fairly competitive environment. And don't forget the competitive environment that we have these days. With gas prices going up or gas prices going down, with inflation going up or inflation going down, there are still lots of patients out there who have lots of elective dollars that they are going to spend everywhere. So my question to you is, are you prepared to give patients what they want when it comes to dentistry? Because, you know, you're not just competing against the dentist down the street and both of you are offering lumineers or both of you are offering whitening. That's not the only competition that's going on. You're also competing when you talk about elective aesthetics or elective implants or a lot of the elective things that we do. You're also competing against that big screen TV, and you're competing against that trip to Colorado in the winter to go skiing or that trip to Orlando for Disney World. Now, I don't want to take that away from any patients at all, but there's lots of elective dollars that patients still have. Yes, even in this economy. You know, dentists, we are a little bit more recession-proof than everybody else. That doesn't mean that this recession may or may not hurt us. It really depends on where you are, what kind of a practice that you have. But one thing's for sure, there are two parts to dentistry. Pain part and the pleasure part. The pain part is the bread and butter of dentistry. That's, restorative, that's crown and bridge, that's endo, that's perio. Those are the things that patients absolutely need. That's not affected all that much during a recession. But I would agree the pleasure part, depending again on where you are, could be affected somewhat, or people may put off that decision a little bit longer for that. This, we've taken 10 steps forward and now we're taking a step back. In terms of the economy, we've done very well in dentistry. 2007 was a terrific year, I would say, for most dentists that I speak to, and I speak to a lot of them during the year. So, it's time to take a step back, and that's okay. That's going to be reflective of the economy. Now is the time to really go ahead and work on the fundamentals of your office. Work on the fundamentals of your office now. When those good times come again, boy, then you'll really spring forward into the next period of economic growth that can really take your practice to the next level. So work on the things, patient relationships, building a great dental team, and I always send you to my website. We've got a great CD series on that. Building the great dental team, the best dental team ever. That's what you need, especially in a hard economy. You need that. The more relationships that you will get with patients now, the more that it will pay off later and later and later, as patients will look to you as their advisor, as their advocate, and as their friend. So now's a good time to work on the fundamentals if you've taken a couple of steps back, but certainly get to continuing education, become a member of the ADA, the AGD, all of those things. It's very worthwhile because it really gets you in tune with where dentistry is going, and that is going to always provide better patient care. That's what it's all about. Thanks for coming to this website, www.commonsensedentistry.com. Take a look around. There's lots of good resources, from a resource list to ways to do 1 hour whitening properly to lots of other good things, and a lot of good audio CDs that I think can help you for your practice. Have a great month, and we'll see you next month right here.